Hi, I'm Dr. Michael Morgenstern, and today I'm going to talk to you about getting started with an oral medication. When we start, we want to find the right formulation and dose of a capsule or oil that can be swallowed alone or mixed with foods like ice cream or peanut butter. I usually start patients on an oral oil administered with a syringe instead of a capsule because it gives more flexibility to start at a lower dose and then to adjust doses as needed. For example, an oil-filled capsule may only come in a 1 ml capsule, even though some patients respond to 0.1 ml or 1/10 of that dose. In general, we may start as low as 0.1 ml and then make adjustments as needed every 3 days, because it can take several days for the drug to build up inside the body. And because oral formulations, unlike faster-acting vapes, also take at least an hour and a half up to 6 hours to start working, it's sometimes difficult for patients to notice if it's having an effect on their symptoms. To get a sense of whether oral types of medical marijuana work, compare symptoms before and 1 to 2 hours after using them. On a scale of 1 to 10, with 10 being the worst, how severe are the symptoms? Also note, if a symptom is worsened by doing something, how is that affected by taking medicine? For example, if bending down worsens back pain, it might be useful to take note of the overall pain level and also the pain level experienced after bending down. 2 hours later, the effect of the medicine can be observed on overall pain and pain experienced after bending down. Since the medicine takes a while to work, it should be taken about 1 to 2 hours before symptoms are expected to be severe. For example, when using the medication for nausea, if the nausea only comes about after a meal, you would take the medicine about 1 to 2 hours before eating. Adjusting dosing works like this. Start at the lowest dose possible, like 0.1 ml, and if symptoms continue after 3 days and no side effects are experienced, increase your dose by 0.1 ml for the next 3 days. Continue this process until experiencing relief or reaching the max dose instructed by your doctor. If symptoms improve at a given dose, continue with that dose. If minor side effects develop, go back to the amount of oil that did not cause any side effects and contact a doctor. Measuring the right dose of medicine is easy. First, push down on the syringe plunger to get out any excess air and insert the syringe tip into the bottle opening. Then flip the bottle upside down and pull the syringe plunger down to the correct dose. This method is similar to administering children's Tylenol using a syringe, which you can see in this video.